The chair now recognizes the distinguished ranking member for his opening statement.
Thank you, Mr. Chairman, and thank our witnesses for being here. Before I open, I do want to mention, Mr. Chairman, this is our first meeting that we've had since the passing of our dear friend and colleague, John Lewis. I know you personally were friends with him for roughly 60 years, and we all feel that loss. Very fitting tributes yesterday, and he was a dear colleague, but he was also a key important part of the movement that has made America an even greater nation. It's very fitting that our country has been paying such a great tribute to a dear friend and an icon in the civil rights movement, our friend John Lewis. Thank you again, Mr. Chairman, too, for having this hearing. I want to thank the witnesses, and I also want to thank your teams, because you represent what is on the front lines of President Trump's plan to combat the coronavirus crisis. For anybody to suggest that there's not a plan, in fact, when you look at the title of today's hearing, Urgent Need for a Plan, that's not the title of a hearing, that's a political narrative, and a false political narrative at that. You wouldn't even be here today if there wasn't a plan, because you are the people tasked with carrying out the plan. In fact, if you were sidelined, you wouldn't be here either. And I know some people want to suggest that, but maybe they haven't spent time reading different components of the plan. These are just a few, by the way, a few of the documents that your agencies have published to show states how to safely reopen, to show schools how to safely reopen, to show nursing homes how to care for their patients, which, by the way, if all governors would have followed those guidelines, thousands more seniors in nursing homes would be alive today if just 5 governors would have followed your plan that was developed by President Trump and is being carried out by you and your teams effectively every day. So again, let me thank you on behalf of the millions of American people who are alive today that wouldn't be alive if you weren't carrying out President Trump's effective plan to keep Americans safe as we learn about this virus, as we work to get a cure for this virus. And by the way, the cure, Operation Warp Speed, is part of President Trump's national plan, and I think we've all seen just how close we are to a vaccine, which is revolutionary in modern time. To be this close to a vaccine, we wouldn't be here that close to a vaccine without President Trump's leadership and without the work of you and your teams to carry out that plan. So again, I appreciate the work that you continue to do. Every day we learn more about a plan, like any plan, whether it's a military plan or a football plan. You start the first play with a plan, and then the plan has to change as things change along the way, and we're seeing that play out daily. When you look at the work that's been done, I think we talk about different parts of the guidance. We've not always been in agreement on each part of them, but we've had a number of hearings where we've talked through how to improve testing. In fact, one of the first hearings we had in this committee on testing was back when America was maybe conducting less than 200,000 tests a day. Today, because of the work that y'all have been doing and because of the president's plan, we're at over 800,000 tests per day, and that number continues to grow. Nobody's stopping, nobody's resting on their laurels, but when you look at that trajectory, again, going from a virus that no one even knew about just 6 months ago, China lied about during that period, where we could have learned a lot more, where we could have saved more lives while China was lying. I wish we would have hearings on that, because that is a real fact. That's not a political talking point. We all know not only did China lie, they corrupted the World Health Organization, and they were perpetuating that as well. It made it harder for us. I remember being in a meeting at the White House with Dr. Fauci months ago, before it was a global pandemic, and we were talking about the desire to get some of our medical experts into China to find out what was really going on, and they wouldn't let you in. The Chinese Communist Party wouldn't let you in when President Trump wanted to send medical experts into China before it spread into the United States. And that caused lives. Why aren't we having a hearing about that? Clearly, we talk about some of the other different things that were done to stop the spread. This president actually did develop an early plan called 15 Days to Stop the Spread. It was one of the first real organized plans to encourage states to pull back. It wasn't an easy plan for the president to have to issue, but it was necessary. And in fact, There were meetings in the White House. I think Dr. Fauci and Dr. Birx were there as that plan was being carried out, that you determined maybe we need to go longer, to go 30 more days. And in fact, by going 30 more days, you could save 1 million, maybe 2 million more lives. And then President Trump announced that plan and did save those lives. The Trump administration then released a plan called Guidelines, opening up America again, on how states could safely reopen. That's this part of the plan, by the way. Maybe some people are so busy reading tweets that they haven't actually read the plan. It's really good guidance issued by some of the most recognized international experts on disease prevention. Some of you here today represent parts of this plan. And so in opening up America, again, showed how states could safely reopen. The plan was developed by public health experts. Some complain that President Trump didn't have the power to force states to reopen. So the administration actually released guidelines so that states had discretion. Each state, we all understand how the 10th Amendment works. Each governor is in charge of their state. Nursing homes are actually regulated by the states, not by the federal government. But we give guidance, and it's been really good guidance. And in fact, that guidance has saved lives. We hear cities, and we hear people talking about the cries of the need for testing. So let's talk about what HHS has done to lead on testing. 0 tests. Again, go back a few months ago, 0 tests to now over 800,000 tests a day. In a matter of just months, over 52 million tests have been conducted nationally. And again, nobody's slowing down. We're actually increasing that number. We will be over 1 million tests a day. Maybe we'll have a hearing on how much progress we've made there, and we want to continue to make progress. I know Dr. Giroir was in Baton Rouge with me just a few weeks ago with the Vice President talking about what we're doing to increase testing, even to limit the number of days as a goal to get below 7 days for anybody to get results. And that number has narrowed dramatically. Now more than half of Americans who get tested get their results in less than 24 hours because of the rapid work that this team has done carrying out the President's plan. Testing is not just about numbers. It's about targeting testing to the right people at the right time. To that point, the Trump administration's begun distribution of rapid point-of-care tests to nursing homes. I've talked to nursing home heads recently who said that decision by the Trump administration to purchase an actual testing kit for every single nursing home in America, over 15,000 nursing homes, each of them will have their own 15-minute test. That will save lives. That's part of this plan. On May 15, 2020, President Trump announced Operation Warp Speed. Again, part of a very directed national plan to combat this deadly virus. Operation Warp Speed is a public-private partnership between several federal agencies to accelerate the development, manufacturing, and distribution of a COVID-19 vaccine, as well as therapies, diagnostics, other things to direct the specific goal of delivering 300 million doses of a safe, effective, FDA-proven vaccine for COVID-19 by January 2021, and we're seeing that happen at remarkable speed. In fact, we're not just going to wait for FDA approval. They're mass producing those vials right now so that if there is one of those vaccines approved by the FDA, it's ready to go. We don't start manufacturing at that point and cost us more weeks. We're actually ready to go. By the way, some of that money was money that we passed in the CARES Act that President Trump has used effectively to be ready as the vaccines are being developed in testing phases. Dr. Fauci, I look forward to learning more about the stunning progress that we've seen researchers make on cures and vaccines. I know you've been involved in researching some of the most awful, deadly viruses that we've known in the history of the world. HIV, Ebola, of course now Corona. We still don't have a vaccine for HIV. There's been over 10 years of work, and you've done remarkable work to at least give therapy so that people can extend their lives, but not a proven vaccine for so many of these diseases years and years later. And here we are 6 months into Corona, and we are this close to a vaccine. So you look at where we've seen the Chinese government. We hopefully will get into conversations about how costly it was, how many lives were lost because the Chinese Communist Party lied to the world, not just the United States, but the world, getting the World Health Organization to give false information in those critical early days. But why don't we now talk about moving into August? lot of work is being done to talk about how to safely reopen schools. In fact, more guidance was just given as part of this plan by CDC to safely reopen schools. We saw, of course, the American Academy of Pediatrics gave great guidance on how to safely reopen school and went further and talked about the damage to children when you don't reopen schools. So much damage being done to our children in those systems where they're talking about not reopening. Hopefully we can shine some light and show those other school systems how they can safely reopen and serve those children, millions and millions of children who are counting on us to get it right. Those school systems have to get it right. There's money, by the way, still available at every state for sanitizer, for masks, for all the things you would need to safely reopen. It's not about money, it's about the will, the desire to do it. We have the will, you've had the will. You have been carrying out the president's plan. Every day we will learn more. Every day we will continue to strive to address the new challenges, but let's not forget the things that have already been done as part of this plan that have saved millions of lives. We mourn every loss, but let's also recognize the lives that would have been lost if you weren't on the job carrying out President Trump's plan to contain this, to find a vaccine, which we're on the brink of, and to help safely reopen our economy, safely reopen our schools so that we can get back to our way of life as we combat this deadly virus. With that, I look forward to hearing from our witnesses. Thank you, Mr. Chairman. I yield back.